Why high deductible plans are changing the game for private practices. The truth is, patients have now higher insurance plans than ever, but the practices are getting less money. More coverage doesn't mean higher reimbursement. So this is one of the important concepts you really wanted to understand. The high deductible plans has really changed patients into a primary payer these days. First of all, I really want you to understand the concept of deductibles. Every insurance payers really want patients pay the money upfront as part of their insurance plans. So this money really ranges from $3,000 to $5,000 and up to $7,000 per plan. So when the plan renews, pretty much at start of the year, when patient sees the doctor, if the deductible is part of their plan, that responsibility purely lies with the patients to pay for the initial visits until the deductibles are met. Once patients' deductibles are met, then insurance start paying to the providers for rest of the balance. For example, if you see a patient today and if they have about $4,000 deductible, so once you send the bill to the payer, once the payer reviews the benefits of their insured member, which is patient, in this case, they finalize and adjudicate the claim with the patient responsibility at the end of the day, because there is a deductible amount which is outstanding with the patient. So in this situation, you really need to chase your patients, you need to follow up with them to collect that payment. You really need to chase the patients to collect the payment instead of getting that payment from the insurance. That essentially means this is going to be a pure responsibility of the patient before the insurance company pays you even a single dime. Now, just because of these deductibles, the bills really falls into the patient account, and patient is responsible to pay these bills. And most of the billing systems are designed in a way where they're unable to chase the payments from the patient side. However, they're really good designed in a very efficient way so they can chase and follow up the payments, keep a track of it with the insurance payers, because everything is pretty much integrated with the payers. So considering that, such tools, pretty much majority of them are really capable of just sending the patient statements either on their mailing address or on their emails, or you can also send a text message to them. So these are good functionalities, but I would say these are limited functionalities available that prevents you getting active follow-ups with the patient so you can really collect that money. So just because of these challenges, practice owners struggle in collecting the due payment, what they're supposed to. So they end up with writing off the claim, adjust the money, whatever patient owes to them, considering a fact if patient is not paying their outstanding balance. And I really noticed this as one of the very common practice being used by most of the providers and the practice owners. And patients delay their care because of the confusion related to the payment matters, because majority of the times patient itself are not really well aware about the concept of deductibles and what is something they're supposed to pay you upfront. Also, the staff do not really enjoy being a debt collector when they ask patients for their outstanding balance or outstanding payments. they end up with either not asking about these payments from the patients because in their head they believe this is not the right practice. And based on my experience, I've really noticed where staff feel really hesitant to ask for such payments from the patient side. And the bottom line is, when your staff is not collecting the payments, patients are unaware about their insurance plans. They end up with dissatisfaction, and also at the same time the morale of your staff also goes down. So this is the fundamental issue and a major problem I have really noticed during my interaction with the practice owners. Just to provide you a real life example, when you verify the benefits of the patient, so you really get to know how much is the deductible currently outstanding for this particular patient, and if there are any co-pays or the co-insurance that's part of their plan. So especially talking about in this scenario, let's assume about 70% is the deductible outstanding amount for the patient, and let's say there's 30% which is the co-pay. Generally, we have seen providers are pretty much efficient in collecting the co-pays in advance. However, they are unable to collect the deductible amount in advance because as part of the process, that claim has to be submitted to the payer. Once the payer, your insurance company, adjudicate the claim, then you get to know like what is the total patient responsibility looks like. So that's where you get to know this is the deductible amount, and that was the copay which you may have already collected in advance. So now talking about the 70% portion, which is really outstanding. If you do not have the right processes in place, so it's a clear revenue loss for you at the end of the day. Generally, as you know, this really happens at start of the year when insurance policies are renewed for the patients in the beginning of year. January, February, March, these are early months where we really notice a lot of such scenarios, and you have to deal with these issues and problems and come up with the right way to manage such plans and to ensure your revenue is streamlined. Being a practice owner, I really want you to understand the psychology of your patients. Patients really don't understand the EOBs. Either the bills are confusing, delayed, or inconsistent. Considering a fact there are lots of details mentioned in an EOB, which is explanation of benefits. A copy of it really goes to the patient. As a provider, you also receive a copy of it. When a patient receives it, they are unable to comprehend it in an appropriate way, so they can understand calculations mentioned there, what are their benefits, what are the procedures performed, what was the payer responsibility, and what is patient's responsibility as per insurance records. So a patient ends up with confusing themselves, and they either reach out to the provider office, and in some cases they don't bother reaching out to you and get some details about their outstanding payments. In this situation, patient thinks I will deal it later, but they end up never responding back to you. While you understood the psychology of a patient, now it is important for you to also recognize and understand the challenges are being faced by your practice staff, your billing operations team. Your front desk team feels awkward when they ask thousands to the patients in advance. So that's a bigger challenge because they're never trained for it. Consider that when there is no script, there's no training, that's equal to missed opportunities. That essentially means the lack of training, lack of having the right processes. Your front desk team is not really in a position to deal with the patients when there's a matter of money to be collected. So these challenges are impacting your revenue badly. Imagine there, if you're losing a revenue about 20 to 30% just because of less awareness, less training, and it is negatively impacting your collections and your business revenues there. As a business owner, collection is the topmost priority for you. It is your responsibility to chase your accounts receivable, making sure that money is coming into your bank account. Considering a fact when you are unable to collect payments at your practice level, so at the second stage, you give this task to a collection agency. That's generally a third-party companies, agencies who work on your behalf. They reach out to the patients to collect the outstanding payments. Generally, this is not ideal situation where we have really noticed some of the collection agencies are not very professional. Their job is to collect the money one way or other, but for you, the patient satisfaction is the topmost responsibility so that you can retain your patients and they feel satisfied and engaged with you as well. Hence, some of the providers, some of the practice owners refrain themselves outsourcing their collections to third-party agencies. Here is the framework that practices can implement right away. So I'm going to provide you a 4-step formula that will help you collect the deductibles and the patient responsibility for your practice and grow revenues. Step number 1 is financial counseling upfront. The staff explains about the cost before the care. The transparency sets the patient expectations. It is highly important that you educate your patients in advance before you see the patient. That should be responsibility of your front desk team or your customer success team who interact with the patients before they see you as a provider. So more your staff becomes transparent, very clear in terms of the financials, so you can really explain them according to the patient benefits, because this is a regular practice. You verify the benefits, you get to know what is the patient responsibility looks like. So you explain those benefits to the patient and explain them like at what stage they are responsible to pay this amount, either upfront or once the claim is adjudicated. What's that process is going to look like. You will receive either an electronic statement or a paper statement. So they expect something after the claim is adjudicated in just generally 2 to 3 weeks time. They should be expecting a bill, and once they receive the bill, and let them know how they can make the payments. For an example, a patient's deductible amount is $500 and the claim amount is, let's say, $200. So you need to explain them like, this is your total deductible which is outstanding. Out of this amount, you will be paying $200 to the practice and you still have $300 left in your deductibles. Hence, education plays a very important role, and the patients do feel comfortable, they understand it in advance, so they do not end up with having any problems while making the payments to you. The second method you can use is card on the file system. Like hotels, gyms, and the software subscriptions, the secure cards are stored for the balance settlement, and it reduces the awkwardness, and the collection happens automatically by the system. This is a very commonly used method, and patients are well aware about it because they have been paying the payments to different organizations, different companies, and this is a widely accepted and utilized method. So once you have such process in place, such method in place, you integrate your system with the secure payment gateways. This helps you streamline the collection process for your practice. The practices that use this method, they have reported an increase of their outstanding collections by 30 to 40%, which is huge, and that adds a significant portion of the revenue for your practice. And the next important method in this framework is structured payment plans that offers flexible and manageable monthly payments. It also removes stress of the patients and frequent chasing from your collection teams or your front desk staff members. By providing such flexible payment options on installments, you're telling your patients that you're not just only care about their health, but you also care about their financial matters. You really frame your conversation and such plans as a support towards your patients. Instead of they feeling it as a burden, they accept it as a blessing and avoid you or the outstanding payments. And lastly, the payment reminders plays a very important role in payment collections. Payment reminders through text that help patients to really understand what balance they owe to you and what are their due dates. It is also important that your text messages, your email content has to be professional and consistent so that patient understand it and avoid any kind of shocks at the end of the day related to their outstanding bills. And considering the human psychology, they prefer gentle nudges instead of active collection calls, so they feel comfortable when you use text or email method there. So this framework is just not optional. This is essential. All these 4 steps that I've mentioned, these are important to follow. You might be following one of these steps and it is really working for you, great. But if you really apply pretty much all of these methods, that will just not help you reduce down your accounts receivable, which are kind of due towards your patients, and your revenue will increase, your cash flows will fast track, and your business will grow substantially. So it is crucial, it is important. I can't really emphasize more on it because based on the research, these are the key steps that practice owners are actively pursuing and implementing and get the desired results. It's all about the mindset shift and reframing the conversation that works well. Many practices fear that patients will resist paying it. However, the reality is the patients value more about the clarity and honesty. Being upfront with your patients is always great. They feel comfortable with it. It really builds trust and strengthens the relationship between you as a practice owner, the provider, and the patient. Having meaningful conversations, making them realize the importance of it, making them realize about their responsibility in a proactive manner is always proved to be one of the best strategies that you can implement in billing operations to ensure your collection efforts are pretty much smooth and seamless. These are generally considered as corporate best practices, and once you implement these practices, what kind of image you are creating in your patient's mind. They feel comfortable while getting a care from a professional practice, professional providers, and the staff. High deductibles are not going away anywhere. These are essential part of the insurance plans, and some of your patients, pretty much majority of your patients, will have deductibles in the future as well. However, practices that adopt best methods to run their practice, follow the best processes that yield better results, will remain ahead in the game and also protect their revenues as well as build trust with their patients. So considering this fact, you should really start leveraging and implementing these processes to maximize your revenues and grow your business. In my next video, I will provide you with patient communication scripts to make your collections natural and stress-free. Subscribe and follow me so you don't miss it.